What is whiplash? Whiplash is a sudden injury that happens to the neck. It's very common that it may be due to a car crash or a fall or a slip. And this is where the head goes forward and very quickly goes back into extension. The actual injury part and the mechanism is in that extension. So when we have, say, things coming more forward and then very quickly coming back, it will just start to pinch on these joints here, start to compress on those nerves, and that's what creates that injury to the neck. For some people, it may be something severe. It may actually cause some small levels of fracture into the bones. Majority of people, though, it's not going to fracture the bones. It's not a very common thing to see, but usually it will create more tension in the muscles because they're reacting to this big movement it's not ready for. And it's going to start to put a lot of pressure onto those nerves, which can explain some of the neurological symptoms that people have following a whiplash, such as sensitivity to light, sensitivity to sound, sometimes they're eye tearing, eye pain, or even say having tingling down the rest of the arm, the hand, or the finger. If you have had a whiplash, concussion, or other head injury, an x-ray or other scans would usually be needed first to ensure there's been no damage to the top parts of the neck and the spine. Once these tests have been taken, this is where doctors may talk about treatment options. For many times, they're going to recommend things like painkillers, maybe some anti-inflammatories, maybe even some muscle relaxants. But we find that for many cases, it doesn't really get to the cause of the issue, it's just dealing with the symptoms. So it's very common then that someone may have some small levels of improvement, but then it may come back afterwards. And the last thing we want to see is someone having a whiplash, but then it becomes a problem that's still there 3 months, 6 months, 12 months down the line. Another approach can be stretches and exercises. And again, this can offer some level of symptomatic relief. However, if there are misalignments at those joints, stretching those muscles and strengthening those muscles may not be as effective. Here at Vitality Chiropractic, we have years of experience with whiplash and concussions. We've seen patients where they've had more recent injuries, or even patients where they've unfortunately had this as a long-term chronic issue that's been affecting them years after their accident. We specialize in the neck and we focus on helping to realign these top joints which may have been affected by the injury. If there has been that misalignment, that's where things may be, say, like this, more out of place. And by using very gentle techniques, we can help to guide the bones back more towards an optimal position, taking pressure off the nerves, allowing those muscles to relax more naturally, and allowing our patients to get back to their normal lives. If you've experienced a whiplash, leave a comment below or follow us to find out more information.